Hello everybody. Myself Dr. Srinivas Kandula, practicing endocrinologist at CARE Hospitals, Mushirabad. A very frequently asked question or a common notion among many diabetes patients is that white rice is harmful as it could worsen blood sugars. Well, rice, which is predominantly rich in carbohydrates, can really shoot your blood sugars when consumed in large amounts. For that matter, any food item, if consumed in a regulated and in a well-controlled portions, will not worsen your blood glucose control. This applies to white rice as well. White rice consumed in large amounts can definitely worsen blood glucose levels, because this being a rich source of carbohydrates, it will be transformed into fat in the body and will accumulate in the form of fat, leading on to increased body weight, and this would worsen diabetes. Therefore, it is important to restrict the amount of white rice consumption in all diabetic patients. It is important that a diabetic patient, while consuming meals, make sure that the carbohydrate portion in the meal is not exceeding 40%. But unfortunately, most diabetic patients, or for that matter, most Indian men and women, do consume a carb-rich diet which has around 60% of carbohydrates in their meal, and this is the prime reason of excess body weight or poor blood glucose control among diabetics. Few patients come with the question of is consuming brown rice as an alternative to white rice is a good option? Well, brown rice is, for that matter, is rice as well, though its glycemic index is less comparable to white rice, but if it consumed in very large quantities, would not really make a difference. So the take-home message would be to consume rice in limited amounts, making sure that the overall carbohydrate portion in your meal is not exceeding 40 to 45%, and this will really help you to achieve target blood glucose levels.